Welcome back to the Hot Flash Diaries podcast. This is episode number 6, and I am so excited to have my nurse practitioner colleague all the way from Salt Lake City, Utah, Traci Andreason. She is the owner and the founder of Rise Rejuvenation Center. She is a board certified nurse practitioner with many, many years of experience and is an advanced aesthetic injector. She is all about helping people feel and look their best, both inside and out, and either through injectables or women's health treatments. She is definitely an authority in her area as far as women's health is concerned. She is also a national speaker and trainer for her industry, and she is the CEO of Injector's Guide, which is a learning platform for medical professionals. And we are so thrilled to have you here, Traci. I have had the pleasure of doing some one-on-one training with you, both in person and virtually. And I think the second that I saw you on Instagram, I knew that I needed to meet you and to learn from you because I was so inspired with the amount of great work that you're doing around women's health and wellness. And I had the honor to meet you just about a year ago, and it's been great ever since. So thanks so much for coming on today.
Thanks so much for having me. I'm so excited.
I really appreciate it. So, the purpose of the podcast is really to bring light to women's health issues and to talk about our bodies and sexuality, menopause, perimenopause, and really talk about those things that we're afraid to talk about. And also things that we don't know a lot about so that we can learn. And really, it's through knowledge. There's a lot of power. I find that we don't talk enough about taboo topics, and one of them is really related to sexuality and our bodies and sex and all the things that come with it. One of the things that I learned a lot doing our one-on-one training was just about normalizing those conversations. And that one of the things that you said the very first second that we chatted was, if we make things weird, they will be weird. If we don't make it weird, it's not weird anymore. And so talking about these topics really will empower a lot of women. And so I was hoping that you could chat a little bit more about how, you got into the world of women's wellness and sort of what you've done over in your beautiful clinic in just outside of Salt Lake City in terms of women's health.
Yeah. Oh, I love that. Yeah. And I agree. It's only weird if you make it weird. It's definitely been part of my mission to not make it weird, especially because I think a lot of women, fear these types of appointments because we're used to pap smears or, cervix checks, and they're just a little bit more uncomfy. And to be able to shift all of that is really empowering. I got started seeking my own personal journey in that realm. I was working as a nurse in a plastic surgeon's office, and we had a PA who worked there that was doing amazing restorative treatment for women, both for sexual and urinary function. I had just had my first baby, and I was like, oh my gosh, I'm going to be so on top of this. I'm going to go get my treatment. And it was so painful. And I remember I had assisted in these treatments and saw a lot of women laboring through the treatment. I'm like, damn, it must be worth it though, because they look like they're in pain. And I just thought it couldn't be that bad, people coming back. And anyways, I did not go back for my second and third treatment. I could not tolerate it, but I still wanted to have the improvements that I knew these women were getting. And so I thought, you know what, why don't I figure this out? Research what this is all about, all the different treatment modalities, everything that's available to women to help, whether it's hormones or tissue improvement, muscle improvement, regenerative therapies, all of it, and just become more of an expert in that field so that I can understand what do we have to tolerate to be able to get the results that we want. And really was more of a mission of just making it comfortable. And in my journey, I found my fascination and passion for just that field of medicine and how untapped it is. I didn't realize how much there was, actually, how much research is out there, because it felt like such a small, undiscovered niche. And it is so not. It is so vast. There's plenty of research out there and plenty of modalities out there. But then, yeah, with starting Rise, I had for years previously working for other people, introduced those treatments to their clinics and had a lot of amazing, rewarding journeys with other people going through the program. And so I knew when I started Rise that I wanted it to be a huge component of what we do here because it's life changing, as you know.
Hmm. Hmm.
Truly improves quality of life for women. We also treat men here now too. And just being able to be a safe space for people to not only have comfortable treatments, but to have an open dialogue that feels, judgment free and safe and not weird.
Hmm.
So yeah, that's kind of how it got started and where we're at now.
That's amazing. And you've helped so many women and also providers like myself who wanted to learn more, but had a difficulty finding places, train us in all of the different realms, right? And so it was
Hmm.
fantastic. I really felt like when we connected and I was able to see you in person and do that hands-on training, that I was able to connect all the dots and my patients
Hmm.
have benefited and I've benefited too
Oh,
significantly in
amazing.
understanding so much more about it, right?
Yes,
So just to
exactly.
share a little bit more about what it is that you do, and again, we have a lot of overlap in terms of what we offer, thanks to the training that
Hmm.
I've done with you, but really the focus is full body for women, like looking at vaginal rejuvenation, looking at pelvic floor strengthening, talking to women about libido, talking to them about tons of things that they've never been asked before, like, do you pee your pants when you sneeze? Do you pee your pants when you're on a trampoline? What if you go to the gym and you're running? Do you pee your pants? Like things like that that we don't really talk about, that we sort of feel like it's just a normal part of aging. You've had one or two babies, maybe you haven't had children, but you still have these symptoms. It's just part of, getting older. We've got to sort of suck it up and deal with it, when in
Hmm.
actuality, there are so many things that we can do. So what I loved about, again, our training was that you really broke it down into understanding that there is a hormonal piece, and that is very much, a big part of what we talk about on this podcast is, again, hormone optimization. But there's also the tissues that are secondarily affected by low estrogen and low
Hmm.
hormones in general, that become quite thin. And of course, estrogen is a big part of muscle strengthening, and pelvic floor is entirely soft tissue. And so
Hmm.
then when we don't have that estrogen anymore, all those tissues start to become very, very weak. And then pair that with some pregnancies and stretching and then vaginal deliveries, which can definitely be a bit more, what's a good word, laborsome,
Yeah.
to the poor
Yeah.
pelvic floor.
Yeah.
And so the treatments that are offered are great because we focus again on bringing that circulation back to the area. So there's more sensation, better, enjoyable intimacy, but also strengthening that pelvic floor through muscle contractions and then the tissues, regenerating them with some radio frequency. So,
Hmm.
could you just talk about all of those treatments? So, those three main treatments that you offer in terms of pelvic floor strengthening, the radio frequency that you're offering for vaginal rejuvenation, and then also the O shot or the PRF O shot, as far as what they do and how they sort of work together, just to give a bit more detail.
Absolutely. Absolutely. So when I have someone come in for an intimate health consultation, I word it like this, that there are three things contributing to this always. Always, always, the pelvic floor is included, the tissue's included. And what we're doing with PRF and regenerating the tissue, we know that that's included, like decreased blood flow. And we just don't know how much of each is contributing. There's really not a good way for us to figure that out. Maybe down the road there will be, better diagnostic tools. But what we do know is that they definitely are all contributing because, like you said, even in the absence of pregnancy, our tissue and our hormones are changing. And if we are symptomatic, we know that there's an issue in the tissue. So I think the very best, most holistic way to do it is to treat all three, because when we're trying to figure out what is causing it by just starting treatments, which is often what kind of happens in our field. Just a little offshoot here. I think in aesthetics, we have laser companies and radio frequency companies that are pushing modalities. And then we have practitioners who are buying these devices, and the only training they receive is from the device manufacturer. And then they have one device, they have one treatment option, they have patients coming in with a slew of symptoms, and then we say, okay, perfect, well, I've got a device that I will use on you. And I think we have a varying degree of improvement in those women for a reason, right? Like we haven't addressed everything that could be contributing. It's just like when we're trying to do something with the face, someone wants perfectly smooth skin. Botox isn't the end all be all, neither is filler, neither is
Right.
skincare, right? Like it's best when we treat it from all angles. And so that's the method that I like to describe to our patients, is that when we know that we have contribution from all those areas and we neglect to treat one of those, we neglect to have the full picture treated, and perhaps cheat ourselves from full correction. The other thing that I like to mention to them is that we have two pathways we can take when we're treating intimate health. One is corrective and one is preventative. And if we're doing it right, we're knocking both of those out at the same time, right? When we're correcting urinary incontinence, we are also preventing sexual dysfunction and vice versa. Or when we're
Exactly.
correcting the pelvic floor, and for urinary incontinence, we're getting all the sexual benefits from that as well. So I
Exactly.
never feel like it's overkill to tackle all three, because if it's not a problem now, it will be down the road. And it's so empowering for women not to have to suffer. It's just like prevent the inevitable. We know it's going to happen. And we know
Mhm.
it affects all those three areas. So with that being said, we basically have three, like you said, three kind of areas of, and we have our radio frequency that treats the tissue. We have our pelvic floor therapy that treats the muscle. And then we have our regenerative med that helps treat blood flow and sensation. So, our radio frequency treatment, the whole target is that we're treating the vaginal tissue and improving the amount of collagen strength, angiogenesis, all of the new blood flow and new lubrication by restoring tissue. The main reason I ever select that for somebody is collagen production to help thicken the skin. Like you said, as we age and our hormones take effect, that tissue gets thin and lax. And
Mhm.
when it's thin and lax, we have less support of the bladder and urinary function, and we have less friction and sensation for sexual function. So it's a powerhouse to treat the vaginal wall itself. So
Well, and
that's
it's
the,
also great, sorry, just to
yeah, go
prevent
ahead.
urinary tract infections too, right? Because once that vaginal wall is a little plumper, not as dry, then it also helps to prevent UTIs, which is fantastic. I mean, estrogen
Fantastic. Yes.
vaginally will do that too, but this is another robust, tool that we can use that will cause that additional sort of plumping, and it's great for women too who are postpartum, or maybe they're on an antidepressant that tends to dry or cause some vaginal dryness. It's a great
Hmm.
option, but it's so lovely, and again, it's that heat, right, that's generating that collagen production, and it's painless, which is such a nice treat.
Painless.
Yeah.
Yes, I
Yeah.
know people, I'm like, I know it sounds too good to be true, because like I experienced, it was incredibly painful. And I think a lot of people assume that's what's going to happen. To
Right.
get, it's just like with a chemical peel. You want to see your whole face molt like a snake if you think anything's happening. Well, now we have peels that don't cause you to peel, and people almost have to like renew their psychological
Yeah.
thoughts toward chemical peels, because it's like there's no suffering, there's no change, and that's not the way it is. You can get a ton of improvement with a comfortable treatment. And yeah, I'd say the
Exactly.
most people feel is like a hot stone,
Yes.
but
Yeah.
most people feel nothing. Yeah, that's the heat therapy is incredible for collagen production. So that's radio frequency. We use an intravaginal pelvic floor therapy. It's called V-tone. That's the little probe just sits right inside the vaginal wall and treats the whole pelvic floor by causing contraction in the muscles. So we always say it's like 10,000 Kegels in one session, but I think it's more than that. If all the women listening right now go ahead and do a Kegel, what happens in pelvic floor therapy is far beyond what you can do, especially if you've never done pelvic floor therapy. Trying to do a Kegel, you're basically just squeezing the
Oh my
introitus,
gosh,
the
you've
opening.
totally, you have to really think about it. And I remember doing some manual pelvic floor physio after I had my daughter, and the analogy of sort of thinking of a grape being right at the opening and bringing it up to your belly button and then dropping it back down slowly, that controlled movement. And it takes a lot of brain power, because that connection between brain and vagina is oftentimes not there. So it's hard
Yes.
to feel it. It's not like you're isolating, your bicep, you're going to the gym and you're pumping iron, so to speak, to build up these
Yeah.
big muscles. It's very difficult to do that on your own. So it's nice when there's devices that can do that for you. I mean, different to what you have, we have a chair, the B-Pulse chair, that women can sit on, and it's fantastic. Again, it just tones the whole pelvic floor, and it's 14,000 Kegels in 30 minutes, which
Mm-hmm.
is just
Mm-hmm.
crazy. The effect that women have even after one or two treatments is mind-blowing. And it's, to your earlier point, what's interesting is that perhaps not all of their urinary effects are solved within a couple of sessions. Of course, we always recommend
Mm-hmm.
6. So early on, we don't expect it to. But almost always women will say, but I just have so much more sensation down there now. Like, I had sex for the first time in, however many weeks, and it felt different in a good way. I'm like, I know, it's the blood flow. It's
Mm-hmm.
amazing, right? So
Mm-hmm.
it's
Mm-hmm.
it's really cool just to see the changes. And again, something that doesn't hurt. Yours is internal but not painful, and ours
Yes.
is external but also not painful. It's amazing. It's just
Mm-hmm.
this weird
It is.
tapping sensation, at the opening of your vagina, which is not somewhere you're tapped often. So it feels it
It's
feels a
different.
little
It's,
weird, but it's different.
yeah.
Yeah. But it doesn't hurt,
Yeah.
which is important.
No,
Yeah.
it doesn't hurt. And there's some really cool research on the biofeedback that you get from doing something like that.
Yes.
So I always have my patients, at least their first session, I'm like, put your phone down, don't entertain yourself quite yet. I want you to like really pay attention to the sensation of contraction, but also relaxation of that pelvic floor. It is so important because just like we have weak pelvic floors, we can have, hyperactive pelvic floors, and that can cause a lot of painful intercourse and all sorts of things. So I always want people, and we treat that as well here, with pelvic floor actually, and not being able to isolate the pelvic floor is a problem when we run into physiological issues like that. And so I always say, pay attention, get that biofeedback, let that brain make the connection with the pelvic floor so that when you're doing things like deadlifts or squats in the gym, you'll be able to in more of those fibers from the pelvic floor rather than just neglecting them because they're, it's just like such a hard thing to even feel,
Totally.
until you do your first one, you're like, whoa, that's the pelvic floor. That
Yeah.
is, hip to hip, front to back.
Exactly, and that's exactly it. It's hip to hip, front to back. I tell everybody that the same thought process in terms of feeling it because you don't know. You just don't know what you don't know, right? And
Hmm.
again, unfortunately, unlike in other countries in Europe where they offer pelvic floor physio right after women have children as part
Hmm.
of their sort of covered healthcare. I wish we had that here in Canada. I don't know if you guys have anything like that in
No,
the U.S., but
no.
no, of course not, right? It's preventative medicine, so there's no focus, unfortunately. But it's so fantastic because that is the time to really do it. But again, of course, as time goes on and you've had more than one child, or even again that collagen machine sort of stops producing collagen really in our 20s, then it just creates a lot of laxity, and so it's a fantastic way to build muscle. But I always say it's funny. Actually, John and I were in the car recently, and we had stopped at a red light. He's a little bit more of an impatient driver than I am. And there was this lady in front of us, and the light turned green, and she's still sitting there. And he was about to honk. And I'm like, just leave her alone. She's probably doing her Kegels. Just leave her alone. Cause I always tell people when you're at a stoplight, just try to think it like, try to feel that pelvic floor when you have a minute to yourself. Anyway, so now I think he
That is so funny.
doesn't honk at women anymore at stoplights when they're not
He's like,
moving.
she's getting out her ninth and 10th Kegel real quick.
That's right. Exactly. She's getting those in. Oh, yeah. So that's such a great therapy for sure. And then the last is the O shot. Tell us about
Yes.
that.
So the O shot traditionally, I mean, we hear it all over the place. O shot is, a branded name, and it's essentially utilizing regenerative therapies via drawing your blood, spinning out all the growth factors and stem cells and all the amazing things that are typically circulating in there and regenerating tissue, concentrating it and putting it back in. We use it in other parts of medicine, as you know, orthopedics and veterinary medicine and things for joint rehabilitation and sports injuries, all sorts of things. We even use it in surgery for healing. So it's amazing, amazing, amazing stuff. And we utilize PRF, which is platelet rich fibrin. We spin and process the blood right here in the office and re-inject it with absolutely nothing else. And we don't put any other additives, any anticoagulants, nothing. All organic, and put it back into the tissue. Two injection sites, one at the anterior vaginal wall and one around the clitoris. It's amazing at restoring blood flow. I would say that is definitely the thing that I tout the most for that treatment is restoring blood flow and in turn restoring sensation. So much better sensation, all those nerve
Mhm.
endings get a little wake up call. And so better orgasms, better ability to climax, better strength of orgasms, all of that comes from the O shot.
Well, it's almost like fertilizer, so to speak, right? It's helping your nerves. It's helping that blood flow supply, which again is feeding the nerves and making everything feel so much more sensitive. And again, if done right with the way that you've taught me, I was taught by two other providers how to perform this procedure. And definitely the way that you're doing it is phenomenal because there is no even injectable freezing. It's topical freezing with really good freezing.
Hmm.
And that is enough. And it's really two pokes, maybe three in a situation where anatomy is a little bit different. And
Hmm.
it's great and it works so
Very
well.
effective. Yeah,
Super
very
effective.
effective.
And I also love the PRF versus the PRP. So again, platelet rich fibrin versus the platelet rich plasma,
Hmm.
because there is no need for the anticoagulant, right? So it's a
Hmm.
smaller volume and you don't get that burn, right? It doesn't feel like
Yes.
anything. It's so good. So
Uh-huh.
I was certainly grateful, and all my patients that I've been able to help with the O
It's
shot.
so much better. Yeah, and I'm telling you, I think I was made to be such a wimp so that I could help women because I just have no pain tolerance. I won't do something if it's painful. Truly, part of the reason we onboarded PRF, because I mean, I think we talked about this when you were here for your training, that I was looking far and wide to see if anyone had done PRF because typically I'm not a cowgirl. Like I'm not
Mhm.
going to try something unless I feel really comfortable offering it to myself and my patients and my family and my friends, right? Because it's medicine. Like we want to make sure
For
it's
sure.
evidence-based.
Of course, yeah.
I mean, I couldn't find anybody using PRF in place of PRP. But I would use it in place of PRP all over the body very comfortably. And the really funny thing is when I released and announced that I was doing PRF for my O shot, I had a provider, unfortunately, sometimes our industry is a little bit catty, perhaps is the word.
Yes. I think
Kind
you're
of
being
go
too
around
kind.
talking about how crazy I was for doing that because what if somebody was going to, what they say, well, I was going to cause tissue necrosis because the PRF was going to clot up. And it really shined a light on how misinformed we are in regenerative med and intimate health because as I'm talking to Jessica here, listeners, maybe you're like, I don't know, maybe it could. That is the most outlandish thing to say.
100%.
That's like not you can't it doesn't even like I can't even respond to that. I'm like, you got to research what you're talking about, sis, because PRF, the whole benefit is that the fibrin matrix is intact and that clotting happens, and we have a
Exactly.
slow release of growth factors. And the pH is closer to our natural pH. Like it's only winning. And so that's how I felt comfortable bringing it on
Of
without having
course.
anybody to learn from about it because if you know the science well enough and you know regenerative med well enough and you know the tissue of the vaginal area well enough, it's all gain. And that's definitely
Yep.
what I've seen from doing it. I don't know if yours is the same, but so I
That's
guess
all I
sometimes
use.
it pays to be a cowgirl.
Yeah. Well, you
It's
look
so
great in a
funny when I'm
cowgirl
like,
hat, so there you go.
yeah. I'm
No,
like, we have to do it. We have to do it. I can't find any research, but like we have to do this. It's got to be better. And it's been so much better. Night and
so
day.
much better.
So I'm glad it's been working well for you too and your patients because yeah, it's just a game changer.
It has been a game changer, and the outcomes have been better since switching from PRP to PRF, to be honest. I find that,
Good.
again, because it's a smaller volume, it's comfortable and
Mhm.
it just works better. It's more
Mhm.
almost immediate, which is amazing. But you're right,
Mhm.
that's why we don't even need the anticoagulant because there isn't the clotting is not an issue, right? Like that's
Yes.
exactly it. You've got the fibrin matrix there ready to rock and to be able to nourish all the
Yes.
tissues. Like that's the whole purpose behind it.
It's
Yeah.
literally the
Yeah.
whole point. Yeah.
Yeah.
That's what I
Yeah.
was dead. But don't you think like our industry, like one of my like 5-year plan goals is to improve the amount of education and just awareness
Mhm.
to how much information there is to be absorbed in the intimate health space because our industry, if we're speaking of the med spa industry specifically, is highly undereducated in this area. It's all device based and profit based medicine for intimate health. And rather than coming from the other side where we're reverse engineering it, and yeah, it's a profitable business model to improve intimate health for people, but not because we're just finding the next greatest device and operating. It's because we're figuring out what works for our patients, what gives them the benefit. We're actually rolling out. Probably, oh yeah, by the time this podcast airs, it will be news that we're rolling out the Rise Results Guarantee at Rise Rejuvenation Center. And
Amazing.
it means that if you onboard onto one of our programs, we guarantee you have change, you have results, you have the benefit you're looking for. And honestly, would not be possible without having an intimate health program like we do that has literally like 100% satisfaction rate. And I think it helps build trust if people feel like, oh, wow, there's a guarantee involved. And what other part of medicine would we feel comfortable doing that?
Mhm.
You
Well,
know?
and I think because you're tackling all 3 of those areas, that makes sense for sure, and that's actually a good little tidbit that I'm gonna take back and review in my own practice. Currently, I usually offer at least 2 of the 3, not all 3, and usually it's because it's prohibitive
Hmm.
for the
Hmm.
patient. That's usually why we leave one out over the other. But that's a really good point. Is again, it's just tackling all 3. You know that you're going to have better outcomes, just like you said. There's no sense of doing Botox if you're not using good medical grade skincare. Just like you're not going to go and have laser done without using your SPF every day. There's
Hmm.
things that we offer and suggest because we know that your outcomes are going to be better and you're going to protect your investment. So that's a really good point. Yeah,
Yeah, and to that point, if you're it I always think about this when we have a Botox patient come in. I think this is a simple way to really grasp the concept. You have a Botox client that comes in and says, I have a $200 budget. Like, I would rather not treat them at all because it's just not enough to give them the kind of result that I stand behind. Like, I want you to have really natural results. I want you to have lifted brows. I want you to have smooth skin. I want you to have good longevity. I don't want you to spend your hard earned $200 and get lackluster results. I'd rather have you not spend it at all. And
exactly.
that's a conversation we have. And in the intimate health world, it's the same thing. Like budgetary concerns, we'll typically tackle with a payment plan, or they can go a la carte. It just is not part of a program, right? So you can opt to pick and choose. It just means that there's not going to be a results guarantee. That means that you're kind of deciding what your treatment plan is, then rather letting me. And just like with Botox, sure, you could maybe insist that I give you the 15-unit treatment you were looking for, but I don't feel like when you come back and it's not lasting long, responsible for that.
Yeah, and
So
all
I
you could do is
really,
educate.
yeah, exactly. I really just want to empower people. Obviously, it's their money, their body. They get to kind of choose how they execute. But I never recommend going a la carte. I always recommend doing a full program. And like we discussed earlier, a lot of times we're so focused on correction that we miss preventative care. And oh my gosh, I always tell women, imagine if you never have urinary incontinence. Imagine, because don't you think that the timeline for women is that it's just inevitable?
For sure.
At some age and stage, you're going to have urinary incontinence to some degree. And imagine a life where you don't have that, like my sexual function patients. I'm like, let's tackle it all. So, yeah, I love
It's
that you.
interesting that you say that because so in my office, I have a pelvic floor model, which shows all of the muscles of the pelvic floor and then the organs inside of them. I actually wish I had it here just to throw it on camera.
Little
And then
show
I
and tell.
have,
Yeah.
yeah, a little show and tell. And then I also have a vulva. So
I love it.
I have,
Oh, I
I
don't
have
have mine
both.
in this room either.
Well, you actually inspired me to have these models because I love that you had them. And it makes sense because one of the things I've learned in doing more and more and more assessments with women is that they don't understand their own anatomy and they don't
Mhm.
understand how things change. And I get that because we're not taught, right?
Mhm.
But it's so interesting when women can actually see, oh my gosh, there is nothing holding my pelvic floor up. Like it is
Mhm.
all soft tissue.
Mm.
It just makes so much more sense as to why I may have urinary incontinence when I'm in my 50s and 60s, even if I've
Mhm.
not carried a child or had a
Mhm.
child, right? It
Mhm.
makes perfect sense. So when you actually visualize it, most women are a little jaw dropped and they're thinking, oh my gosh, I can't believe, well, that makes sense now why I'm having A, B, C, D symptoms.
Mhm. Mhm.
But I find it crazy that we don't talk enough about our anatomy. And even when I'm describing what the O shot or regenerative medicine that we offer, as far as the PRF shot, where it gets injected, a lot of women don't even know where their clitoris is. They don't know
Mhm.
where anything is, where their G spot is. They've never sort of self explored. They don't know. Some do, but most don't. And I
Or that
find that
there's two holes.
yes, yes,
Yeah. Some of the stuff that feels like very baseline,
yeah.
it's not there.
But it makes sense. Again, we're not taught, right? But
Mhm.
yeah, it's really crazy, but it's always just empowering. Even at a consultation, I feel that even if a woman, chooses not to have any therapy, they walk away with understanding their bodies a bit more,
Mhm.
which I
Mhm.
think is really important.
Yeah, I think at the end of the day, it's all about empowering women, to one, take care of their body, but also to like know their body, and feel empowered to do what they would like to optimize their body. I always say like uh, it's so different now, but when I was first starting out building the intimate health situation program, whatever, trying to get
All the same.
everything in place, I felt like only people would come in for urinary incontinence. It was very rare that someone would come in for sexual function issues. And I knew that there were sexual function concerns in a lot of these women who had urinary, just based on my questioning and probing, because we're getting to the bottom of it, whether you like it or not, when you're in for a consult, because I really need to know everything. But most of the time, they're like, yeah, but I don't really care. Even if they said there was some issue going on, they're like, but it doesn't bother me. I'm really happy in my sex life. And now that we've spent some time building a little bit more of a platform where it's not weird, I do have a lot more women that come in feeling empowered to even speak up that urinary is totally fine. Sexually, they want an upgrade. And that makes me so happy. because it felt like, gosh, like trying to, what do they say? Trying to get a, I can't remember the phrase, something about an octopus. You know what I mean? I can't remember,
I'm
but
not even
you're
going to
really
try because I
trying,
always butcher those things.
digging, 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 trying to find this information and like prying it from them. And now it's just really exciting to see that even just like what you're doing, just with this podcast and with your Instagram, that when we're inspiring women to like not make it a thing and just like speak it and say it and, you know, have those open conversations. And now it's a very different, there's like no stigma. People come in and they're like, yep, I want my orgasms to be better, or I'm having difficulty reaching climax. And I felt like initially when I was still trying to like kind of build a name for it, that would never happen. I would get it with peeing only. I pee when I jump, cough, sneeze, I'm like, let it out, sister, just tell me, and now like everyone tells me, they tell me in the lobby.
Yep. Yeah, it's so
So
true.
it's
But
so
again, it's those
amazing.
probing with those questions, right? I've had a couple of patients that were a little taken aback by the questionnaire because I send over the female functional questionnaire or a
Hmm.
symptom index. And, they again are thinking, well, I'm coming in to talk to her about my urinary incontinence. Or when I'm sneezing, coughing, I'm peeing. That's what
Hmm.
I'm here to talk about. I don't want to talk about whether or not I'm satisfied in my sexual, relationship or in my intimacy. And so
Yeah.
I've had a couple and I just have to say, well, I appreciate that that wasn't the concern that you were maybe coming in for, but it's important to understand because it's all part and parcel. It's all part of that pelvic floor, all part of that area. And it's
Hmm.
important for me to understand because sometimes you're just not asked those questions. So you wouldn't even know how to answer them. And some
Hmm.
women take a lot of time to fill out these questionnaires because they're like, oh my gosh, no one has ever asked me that question before. Can you
Yeah, and they're
just
like, in the last 4 weeks, hold on, I can't remember what I had for breakfast.
exactly,
So I
especially if
always
you
tell
throw in
people, fill out your forms before you come in because it's quite the survey. Like you're gonna need to
it
really
is.
ponder. Yeah.
And I'd rather ask more than less, right? But then throw in
Oh yeah.
perimenopause with, some brain fog and then you can't remember anything at all.
Yeah, you're like, literally, this is why I'm here.
Yeah.
I can't
Why
remember
am I
anything.
here
I can't
again?
fill this out. Yeah.
Um, but for those listeners that are maybe they aren't familiar with what sexual dysfunction is, can you sort of elaborate a little bit more, maybe take out the NPNS and sort of in more layman's terms so that they understand what sexual dysfunction means in our world?
Yes, and even we can go really broad because it's everything, everything. Like even just psychologically, I talk to women about like we have to dial in and see if this is physical or psychological. Like sexual dysfunction is a very large umbrella. Typically, to me, and what I like to tell my patients is it's any form of dissatisfaction, whether that be physically or psychologically in your sex life. So that can be a lot of different things to a lot of different people depending on their relationship, right? If you have painful intercourse, if you have dryness, if you have difficulty reaching orgasm, if you have decreased sensation, if you have, I mean, any of those things, any combination of those things, decreased libido, all of that falls kind of in that umbrella. And the cool thing is we have tools to treat literally all of it. It's so cool. If it's not me, it's me referring out to a sex therapist, if I feel it's more psychological, but physically we can treat all of it,
And that's what's
especially with
again,
hormones, which you're a whiz at.
it's honestly, I just love it so much. I don't do any hormones for men, only for women. Because I prefer complex beings. I feel like men are too simple in that regard. But coupled with the pelvic floor treatments that we offer and again the regenerative medicine and the radio frequency, it's just so fantastic because you really can feel like you did once before. I find
Hmm.
what happens is, and I don't know if you agree with your patients, what you've been told, um, but you sort of lose yourself, right? Over time, it's like you just are this new, you're changing, but it becomes your new normal. And you don't really
Hmm.
realize until one day you're like, oh, all of a sudden, why have I had a dry vagina for the last, 6 months and this is feeling
Yeah.
uncomfortable, or all of a sudden, intimacy doesn't feel as important anymore, or maybe it's important but it's just tough to talk about. Like we're so busy, right, being moms or friends to our friends, our families, like we're trying to live our lives and be professionals too and pay our bills and do all the adulting that is highly overrated. And then all of a sudden one day you wake up and you're like, I don't feel like myself anymore. And it's
Hmm.
tough. It's tough to identify, let alone to talk about it and to talk about it to somebody that you don't know very well, right? It's tough.
Absolutely. It is very difficult to identify. I think that's the most important component of that because even if we do have women coming in for urinary incontinence, a lot of times it's not that they don't want to admit that they have sexual function issues or even that they think it's weird. It's that they don't even think about that.
Mhm.
That's just not in their wheelhouse of like self-care or even on their radar, especially if you think about women who've had, multiple babies and all the hormonal changes, and maybe they're not done having babies till they're in their, young 40s. By that point, your 20 something year old self versus 40 something has gone through so many changes in the intimate health world. It's very difficult to identify there's even an issue because it's so slow and the changes are great that it's hard to even recognize. Like, I don't know what it felt like before, or maybe this is normal. I think that's the biggest thing. You don't identify a problem if you're not aware. And so I love the questionnaire that you do it for everyone. That's typically a question I'll get from trainees is if you do send the sexual function index to every patient, even if they're just coming in for urinary. I'm like, yes, queen. We know that a lot of women just don't even recognize that there's solutions for these problems, but two, that there's a problem,
Mhm. Totally.
And I think that's our job is to empower women to at least be aware, know their bodies, and ask themselves those questions so that they can be optimally functional in their sex life.
Absolutely. And
Yeah.
that's just it too. You were mentioning at the beginning of our talk that there's lots of different companies out there that have different machines and different devices that, do similar things to the devices that we offer. But the problem is that the training in and of itself is not robust. And
Hmm.
if you're not an advanced clinician who understands women's health, understands anatomy, it's really difficult to offer a robust treatment plan, right? Because you're
Hmm.
focusing on offering what you can offer, but you're not actually tackling all of the issues. And that's where
Hmm.
until I started offering my virtual hormone replacement therapy program at my office, I always felt like there was a gap there because I was still practicing in family medicine and I would say, well, talk to your family doctor. But I knew that that was not a good option because most clinicians are not trained in advanced hormone replacement therapy or to even
Hmm.
understand what hormones are, right? So,
Hmm.
like, that's way back episode 1 and 2, where I go on and on about the Women's Health Initiative, and I'll save everybody the lecture of hearing that again. But it's quite challenging, and so it's no different when it comes to female anatomy, and so that's why it's so exciting to be able to have somebody like you that I can text, call, message, go and see, and just learn so much more about all the things that affect women. It's like we're very complex. We're puzzles. We are not simple creatures, and that's what I love
Hmm.
about us because
I love
we're
that.
unique, right?
Yes,
And
yes.
and so again, it's trying to instead of piecemealing a plan, it's like understanding and being able to provide a good solution that's going to tackle the underlying problems and prevent, right? That's the whole goal is that preventative medicine piece that we've
Hmm.
really
Hmm.
missed the mark on with conventional medicine. So
Hmm.
it's just super exciting.
I love all that. I was just reminded of one of the analogies I think of, and I don't know if we talked about it when you were here, but I, for some reason, liken this to landscaping. And when I talk to patients about, or even just clinicians who are training with me, I'd like to think about it that way because if we think about our devices as landscaping equipment, like say that the most popular one is a lawnmower. And then we have patients like, "Oh, well, I need my yard fixed. I want someone to take care of my yard." And the only thing you have is a lawnmower. All you're ever going to do for that person is mow their lawn. You're never going to edge. You're never going to blow. You're not going to pull weeds. You're not going to plant flowers, right? You're just, all they're going to get is their lawn mowed. And is there going to be a change? Yeah, their yard is going to change for the better. But we've missed so much.
I
And
love
when you
that.
have, even if you don't offer, you don't have the weed whacker yourself, you don't have the blower yourself, whatever it is, you don't have the fertilizer yourself. If all you have is a lawnmower, you should still be having a good referral system
Hmm.
to somebody who does have the weed whacker or the blower because
Exactly.
it's just not even close to the amount of change people get when we do full program. As you know, it's just not even close. It's not comparable. Someone who only mows their lawn versus somebody who's got a full landscaping company, their yards are very clearly differently optimized. And I think
Hmm.
about it, it's a good way to talk to patients about it to really get the whole picture. It's like, well, yeah, you're going to see change. You're going to
For
feel
sure.
change. You're going to have change. But are you going to be like yard of the year, or are you going to be like I hired the teenager down the street
Yeah.
to mow my
For
lawn.
$5 an hour. Yeah.
Yeah, yeah, yeah. You get what you invest in. So,
Yeah, it's really wild, and I just wanted to share a quick story with you that I've been covering for a family doctor, doing a little bit of locuming most recently, and I came across a lady who the receptionist had sent me a message and said, "Hey, she thinks she has another urinary tract infection. Can you send her a prescription for an antibiotic?" And when I looked in her chart, I realized that she's this lovely 89-year-old lady who had, a ton of children. I want to say 5 children,
hmm
had a hysterectomy at the age of 33 because she had some endometriosis and was never put on hormones. So had such a hard time with that. But what's
hmm
worse yet is that since January of this year until now, she had had 9 rounds of antibiotics for recurrent urinary tract infections. So I said, absolutely no more antibiotics. I need to see this gal and see what's going on. And so what's interesting is that after all the babes that she has had, she had seen multiple urologists, multiple gynecologists, and different family doctors. Nobody talked to her about her prolapse. That was the very first obvious thing that I found upon an examination. And that she had a terribly dry vagina that was causing her urinary tract infections. She is a lovely lady that we are now looking after, and she's having some great results. But it's just one example of like, here we are now, fast forward at 89, and she is suffering and has been suffering for many, many, many years. And I think, gosh, if anyone just would have taken a moment, and after seeing so many specialists, but the reality is that the urologist will fix the urology piece. The gynecologist is like, okay, well, she's having urinary tract infections. That's not anything to do with like, you know, her uterus.
yeah,
She doesn't have a uterus
uh-huh.
anymore. So off you go. Right. It's just like
Yes,
people are just like, it's all piecemealed as opposed to taking a really good approach and saying, okay, wait a minute, really what's going on? And I'm
yeah,
glad
big
that they
picture.
ruled out all the sinister things, but the most basic thing, like some vaginal estrogen, some pelvic floor
Yes.
physiotherapy, all of that stuff that could have prevented. Right. So we don't want to turn into that lady. We want to have our
hmm
patients be, feeling great and at the tender age of 80 and 90, having still that wonderful longevity in their life and living well and being independent and being able to feel great, right? That's the whole goal. And
Absolutely.
part of what I think we don't talk about enough in terms of vaginal health and keeping that tissue like really feeling plump and good is that prevention again of the urinary tract infections, which really does save lives. Like how many women
Yeah, it does.
end up having urosepsis, which is essentially full body infection as a result of a really bad urinary tract infection. Couple that
hmm
with having multiple rounds of antibiotics that you end up becoming resistant to, right? And then we're stuck as clinicians. It's like, okay, what antibiotic do we give you now? You're resistant to everything. When all we had
hmm
to do was restore vaginal tissue, right? It's just
Right.
wild to me. It's wild. Anyway,
Yes, I know. And it's just low hanging fruit that people like aren't even aware of. I'm sure you've run into this where we try to partner with OBs and gynecologists and even pediatricians because they see moms, when they have their newborns and partner with them, educate them on what we offer just so that there are more people in the community that are armed with the information to know that there are solutions, even if they don't send them to me, even if they get a device and put it in their office, whatever it is, like
totally. Yeah.
the information is not available to patients. And most of the time we don't get a touch point with them because we're not delivering their baby, we're not taking care of the babies, we're not their I wanted all those touch points. And the amount of pushback I get in the medical community for what I offer is maddening. Like it's almost like they think this is like woo woo or like it's fake medicine. It is mind blowing to me because we're
It
changing
is
lives. I know that sounds cheesy, but changing lives with what we're doing, preventing massive infection, preventing urinary incontinence, improving quality of life, improving relationships, saving marriages, I'd even say.
100%. Oh my gosh. I feel like that should be my slogan with HRT is like saving one
Yes,
marriage at a time, right? Because it's
yes.
it's brutal. Yeah,
It is
absolutely.
so insanely intertwined with so many things, like cute grandmothers coming in saying, "I played pickleball with my grandkids for the first time at the family reunion I host every year for the last 2 decades." Like, it's life-changing stuff, and to get, like, basically laughed out of an office with what we offer is insane to me. I'm like,
It's
"It is
heartbreaking.
evidence-based, it's evidence-based," but it's
100% it is.
it's cash pay, it's not insurance, covered, which is unfortunate. And I think that alone makes people feel, I don't know, what some sort of way, but I'm like, don't trust anything. Like, think about hormones, I'm like, you're not going to
Totally.
get the same in primary care as you're going to get in specialized care. So, anyways,
Yeah,
if
that's a
anyone's
whole other ball
listening
of
to
wax.
this and you are in another part of medicine, please educate in this field so we can help our patients, get better.
100%. That's just it. I always say if I had more time too, I would also tap into retirement homes and,
Yes.
different long-term care facilities too to chat with people, because it doesn't mean that because you're 70, 80, 90, you can't do anything about this. Are you kidding?
Mm-hmm.
There's never a bad time to get on the pelvic floor strengthening and vaginal rejuvenation train,
Mm-hmm.
like ever.
Mm-hmm.
And just
Ever.
like you
Yeah.
said, it's evidence based. It does improve, your whole quality of life. It does change
Mm-hmm.
lives. Even
Mm-hmm.
this sweet patient that I mentioned, she came in for her third or fourth treatment out of six, and she said, I can actually hold my bladder now to go to the bathroom. And that was a huge win for her because she couldn't even do that before. She goes, I'm
Mm-hmm.
still having some dribbling here and there, but it has been much better. She was able to go out and play bridge with her friends recently, which I thought was so
Mm-hmm.
sweet. And it's adorable. She brings her knitting and she sits on the chair for 30 minutes and she knits away as she's on the chair. I'm like, I love this. This is life goals right here.
Yes,
It's so
it is.
sweet. Yeah,
Oh, yeah. A life-changing one example, one little story I'd like to share is one of my most severe patients. And I was worried that I actually wouldn't be able to help her because I hadn't treated somebody with such severe issues prior to her. But she was multiple pads per day. She had leaking with going from sitting to standing. She had leaking if she didn't get to the bathroom soon enough. She had leaking with jumping. She had leaking during sex. I just felt like this has got to be probably something surgical. Like it just felt so severe.
right.
I fell into the trap of it must be too good to be true that something painless could help somebody like this. But she was determined, she's like, no, I really want to give it you know, a really good effort before looking into anything surgical. And of course I was game for it. I was just more nervous. Like I want to be sure that I can give people the outcome they're looking for.
For sure. Yeah.
And to make a long story short, she went from, yeah, 5, 6 pads, not panty liner, pads per day to like a panty liner per day.
Oh my goodness.
She went to playing racquetball with her new boyfriend. She's now having sex. She's got better relationships. Before at work, she would go pee right before a meeting and never schedule a meeting for more than 30 minutes because she'd stand up from the meeting and pee. And it's just life changing. And of course, we were like jumping and hollering and, during her follow up, I'm like,
Yes.
yes. But
Amazing.
that is just next. And nothing was painful. It just is so crazy that this isn't like on billboards loud and proud, like who's not doing this? We all need to be doing
Yeah.
this because it's just a no-brainer, right? To get that kind of change in your life without really I mean, a financial investment, but what you get back in return, I think is just worth every penny.
Worth every penny. And again, think of all that money that she would have been spending on incontinence supplies, right? That
Mhm.
they're not inexpensive.
Mhm.
So that in and of itself would be crazy in
Mhm.
terms of the benefits, right? Financially for
Mhm.
her. But
Mhm.
that's I have had some women who wear suits to work and they say, I literally have to have a change of clothes sometimes because exactly that, standing
Mhm.
up from a boardroom at a boardroom table about to walk out and there's leakage, so we've been
Mhm.
successful in helping a lot of women feel better. There are some cases, like you said, that are very severe, but they don't want surgical, options, even if it's been offered. I have one lady in particular who's been on the wait list, and unfortunately here in Canada, our healthcare system is a little wonky and it takes a long time to get into specialists, and also waiting for surgeries that are, what's deemed sort of elective. And unfortunately, this lady is quite young and she's like, I need some solution to get me to the surgery. And I said,
Mhm.
well, let's do this. And the improvement, of course, she still required surgery, had multiple prolapses and is quite young. But, the fact that we could get her there and she had, a reduction in her symptoms by 75%, like
Mhm.
that's life changing after years and
Mhm.
years of having severe symptoms.
Mhm.
And again, the fact that it's painless and what have you is amazing. But
Mhm.
yeah,
I love
there's
it.
just so much. And I love the idea of collaborating with other professionals too. But I think because it's just a taboo area. Like a lot of women won't even talk to their family doctors about their vaginas,
I
and
know.
let alone, hormone changes. I talk a lot about that too, where, great clinicians out there who know their hormones, but because they're male or maybe older, women don't really connect as well with them on that front and they don't feel as comfortable talking about it. And so, again, just trying to normalize those conversations and say it's okay to talk about your body parts. It's okay to say, I don't
Mhm.
know. It's okay to say, these are the symptoms that I'm feeling.
Mhm.
And I think there are changes that are happening. I think it's very positive, and all we have to do is just keep talking about it.
Yep, that's right.
Yeah.
Just keep running our mouths about it, and eventually, enough
Yeah.
people will hear it. It becomes normal, truly.
Yeah, it's true. Even though I feel like I'm traumatizing my children and my family all the time because all I talk about is hormones and vaginas, but I'm like, you know what? You'll be better people for it. And their friends are over and I'm having conversations with colleagues talking about it and they're like, "Mom, you're so embarrassing." I'm like, "It's fine. Like
They're gonna
you'll."
need therapy for something. Let it be that.
Exactly. I'm giving the therapist lots of material to work with, so it's all
Yes, yeah,
good.
yeah, yeah.
But that's amazing. Thank you so much for this chat. I hope that the women listening, and men too, feel a little more empowered and understand their bodies a bit more and understand that there are hopeful things out there for them to be able to participate in and to do to help them feel better in all the ways. I think that there's so many more treatments to come in years to come, and I'm excited that we're doing this. I'm excited that you're a colleague only a call away and that we're doing this. It's great.
Yes, same to you, Jess. Very, very grateful to you.
Well, I will sign off then. Thank you so much, Traci, again for coming on. I hope you have the best day and all the listeners have the most fantastic day. Our next episode will be launching in a couple of weeks. Where I interview Dr. Nan Wise, who is a neuroscientist and sex therapist. So, we're going to continue on the conversation of intimacy, but specifically around orgasms and the whole idea of pleasure for women and the pleasure centers of the brain. So, I'm super excited to learn more about that. And I know, Traci, that'll be right up your alley. So, I'm sure you'll listen to the episode.
Absolutely.
So, thanks again. And I wish everybody listening the most beautiful day. Take good care.